Good afternoon. I'm Tinashe Mutsvangwa, and I'm the lead in a research group called the Medical Image-Based Inferencing and Distributed Diagnostics Group, based in the Division of Biomedical Engineering at the University of Cape Town. Myself, two graduate students and a postdoc from our group are honored to be able to present some of the work we are doing on at this conference. So this is just a slide showing the group members currently. There are two senior investigators in our group, myself and Professor Tanya Douglas. And we have several members at fellow PhD and master's level, and you'll be hearing from three of them today, namely Dr. Bessie Malila, who's a postdoc, Ms. Yvonne Karanja, who's a PhD candidate, and Ms. Taryn Dawood, who is an MSc student. Just as a matter of background, although our research caters to all population groups, some of our work has implications for the elderly and aging populations. So the group has two thematic axes. The first is medical image inferencing, and the other is distributed diagnostics. So the acronym is Me2D2. The Me2 axis primarily focuses on novel low-cost imaging and image-based solutions for computer-aided diagnosis in resource-limited and remote settings, of which we can consider South Africa to be a resource-limited setting. And within this axis, we employ state-of-the-art methods in artificial intelligence, including machine learning, deep learning, statistical modeling, as well as mechanistic modeling for both foundational and translational research. The other axis is distributed diagnostics, where we investigate on ways to increase the reach of the technologies that we're developing. And here we look at emerging technologies such as blockchain, X-road, and augmented reality as mechanisms for enhancing access to healthcare. Some of the diseases and disorders we're focused on include tuberculosis, fetal alcohol syndrome, osteoporosis, obesity, and Hodgkin's lymphoma. And two of these, osteoporosis and Hodgkin's lymphoma, will be discussed by members of our group later. So we're motivated by the desire to bridge the radiological divide. And briefly what that is where patients in well-resourced countries have easy access to well-trained radiology staff and state-of-the-art equipment. And yet more than half of the population living in low to medium income countries has little to no access even to the most basic medical imaging. For example, regardless of the known benefits of 3D medical imaging, most countries in Africa report 1 CT unit per 1 million inhabitants, compared with, for example, Denmark's approximately 24 CT units per 1 million inhabitants. And of course, this divide is reflected within South Africa's healthcare system. So the question we ask ourselves is, what can be done? So together with collaborators from Europe, we're trying to bridge this divide. As an example, I'll briefly discuss or describe our flagship project, which is 3D reconstruction of bone from 2D X-ray. So 3D imaging provides more insight than regular X-ray. However, 3D imaging modalities are expensive to procure, maintain, and also to operate. So in our approach, what we're doing is we're taking example 3D patient image data from CT scans, and then we develop what are called statistical models that encode the variation of morphology from a population. We then fit these 3D models onto 2D patient X-rays, and we get 3D patient-specific reconstructions. The advantage of this approach is that the 2D X-ray is commonly available and cheaper than 3D imaging such as CT or MRI. And so the idea is to hopefully pass the cost saving to the patient and thereby also increase access to advanced 3D imaging. Taking this a bit further, we're working towards a distributed image diagnostics ecosystem, and I'll illustrate this using some of our work in orthopedic imaging. So we can imagine at the front end of the ecosystem, we have a patient imaged in a remote hospital with more readily available 2D X-ray. And through a secure communication network, we'll be able to transfer the image data to a central processing center or the back end. And this is where the 3D reconstruction will be performed. And then the 3D reconstructed bone is sent back via the communication network to the remote point of care center where it can be used for treatment planning, rehabilitation, etc. So for the elderly, this can, of course, result in the reduced need to commute to large healthcare facilities where advanced imaging is available. So next, I'm just going to briefly introduce on our graduate speakers and their topics and how they speak to different aspects of such a distributed ecosystem for imaging. First, we will have Dr. Bessie Malila, who will speak to you about a general problem we need to solve if we are to be successful with this ecosystem, which is how can we securely transfer patient image data over communication network. Her research is leveraging the emerging technologies of blockchain and 5G for developing such a network for mHealth and telemedicine. And while her research has implications for all forms of patient data, she will highlight the utility of her research for secure sharing of health data in care homes. Next, we'll have Ms. Tarine DeWood, who will speak about developing an ultrasound-based low-cost decision support tool for Hodgkin's lymphoma. And our work is focused on the back end of the distributed diagnostics ecosystem. The technologies she's developing may lead to earlier intervention, which can improve longevity and also improve prognosis for the elderly. Finally, we'll have Ms. Karanja, who's a PhD candidate, who will speak about developing developing a framework for three-dimensional estimation of bone mineral density from X-ray images, and how that will improve diagnosis of osteoporosis. Her work is also on the back end of the distributed diagnostics ecosystem. Again, the technology she's developing may lead to earlier intervention, which can improve longevity and also improve prognosis for the elderly. So in conclusion, all of the technologies we're developing will lead to increased access of advanced imaging for all populations. But in alignment with this conference, our students will highlight the implications of these technologies for the elderly. These are my contact details, and we're always keen to form new partnerships and collaborations. Thank you.
Thank you very much, Dr. Mutsvangwa. Health equity is clearly a major challenge in our current world, and so it's great to hear about technology that tackles these major societal issues, and you've outlined them very well for us. I just have a brief question relating to, you pointed out that you applied blockchain to some of these questions. Can you briefly just illustrate how blockchain can be useful for these purposes?
Well, so the idea with blockchain is to leverage the distributed networking capabilities so that we can be assured that if there's any breach in the data, as it's been transmitted from either remote care center or from whatever, from wherever it's being transmitted to a processing center, the integrity is maintained. So we're trying to leverage the capabilities for security here.